The origins of Greek medicine. If you're curious about how Greek medicine came to be, you're about to uncover a fascinating history that blends ancient beliefs, practical observations, and the contributions of some of the most influential figures in medical history. Greek medicine has its roots dating back to around 700 BC, a time when the concept of medicine was still in its infancy. Initially, the Greeks believed that illnesses were divine punishments and healing was a gift from the gods. This spiritual approach was evident in the early practices, where people would often seek healing at temples dedicated to the god Asclepius, known as Asclepius. Here, patients would enter a state of induced sleep called enkomesis and receive guidance or cures through dreams or surgery. As time progressed, Greek doctors began to shift away from purely spiritual explanations and towards more natural and rational approaches. One of the key figures in this transition was Alcmaeon, who worked at the medical school in Cnidus around 500 BC. He is credited with being the first to consider the internal causes of illness, such as environmental problems, nutrition, and lifestyle. The most significant figure in ancient Greek medicine, however, was Hippocrates, often referred to as the father of modern medicine. Hippocrates established a medical school on the island of Kos and, along with his students, documented numerous illnesses and treatments in what is known as the Hippocratic corpus. This collection of texts includes the Hippocratic Oath, which is still used today, and introduced medical terms like acute, chronic, and epidemic. Hippocratic medicine was characterized by the theory of humor, which posited that good health resulted from a balance of, for humor, blood, phlegm, yellow bile, and black bile. Each humor was linked to specific organs, temperaments, seasons, and elements. This theory guided many of the treatments, which aimed to restore balance to the humor through diet, lifestyle changes, and sometimes surgical interventions. Greek doctors also gained practical experience through their involvement in wars, where they developed skills in first aid, setting broken bones, and treating wounds. They used various methods to close wounds, including thread and dressings soaked in substances like vinegar, wine, and honey. Despite their limited understanding of infection, they made significant strides in surgical procedures and the use of natural remedies. The influence of Greek medicine extended beyond Greece itself. With the establishment of the city of Alexandria in Egypt, Greek medical practices spread throughout the Mediterranean, influencing Islamic and medieval European medicine for centuries to come. In summary, Greek medicine evolved from a mix of spiritual and practical approaches, with key figures like Alcmaeon and Hippocrates laying the groundwork for a more rational and empirical method of healing. This legacy continues to shape medical practices today.